Good evening, guys. Okay, today it's episode 167. Welcome to ADHD and medication update. All right, so no matter who the patient is, before treating with any drug, they should conduct a thorough assessment and refer to psychologists who do legal testings like what I have. And that legal testing is actually can be used for anything, for school, for PhD, for your master's, for your LSAT, MCAT, GMAT, even PMP exam, pretty much anything. But it has to be legal, and it's not done by a psychiatrist, only done by a psychologist that is licensed and legally able to conduct the exam or testing, whether it's DSM-5 or additional other testing that was researched on and approved by the government and is used legally for everything. So remember that. If the patient is a child in school, part of the assessment would be talking to the parents about what the home life is like. Usually that doesn't work because the parents lie. Academic life as well, and sometimes that involves getting additional information from teachers with the permission of the parents, of course, for minors. Most psychiatrists also do a differential diagnosis to determine whether the patient has another disorder along with ADHD or instead of it. Now, I have commented on that. There are dual diagnoses that are actually true, and there are ones that overlaps each other. They're symptoms, they are not conditions. So remember that and figure it out yourself. I might ask about conditions such as depression, psychotic symptom, manic symptom, OCD. Everybody has OCD, anxiety, panic. This is just one of the psychiatrists said that. So I've looked at a broad range and the DSM-5 to be sure I'm not missing anything. And if it seems like the attention issue are the primary component, we will treat around that. I have something to say about that. ADHD, you're born with it. I completely do not agree with the fact that ADHD is developed because of external environmental factors. I mean, that doesn't make no sense to me whatsoever. Okay, your brain doesn't just anatomically change because of the actually, you know what, that's not true. Okay, you know what, forget about that, the last part. I'm sorry. Mental health professionals treat most of the patients through a scientifically guided process of trial and error, and that is the hardest part about ADHD and medication, because your body is changing, your medication needs to be changed, maybe your dosage needs to be changed, your per dose per day, it needs to be changed as well. Like for me, it's just extremely hard when I eat it. I cannot focus, I cannot function, I feel burnt out, I have no focus, I am impulsive, I get anger issues, like, it works for people and it doesn't work for people. So after, and also another thing that I want to say is I do not support kids being placed on any kind of stimulant medication until they are really properly diagnosed at age of, I would say, after 12. And that is the age where the psychological and cognitive developmental part started to mature and stabilize. So if you're putting a kid who is 6 years old, that's what it was saying in one of the research, like their brain is still developing, so you're like fucking it up. You're mushing it up, you're fucking it up. Like, we're already mushing enough, and then you just shove it in the kid who's 6 years old. Like, that's fucking crazy. Anyways, after a child is fully evaluated, they're usually starting with a methylphenidate such as Ritalin, Concerta, or Forcaline because of the lower side effect profile. Methylphenidate is actually one of the oldest and most stable medication that is, and that is what I'm on. It's immediate release. I had SR before, sustained release, and that worked for me as well. However, Adderall didn't. I took 1 week of Adderall in one day and I fell asleep the whole time. Vyvanse, I had huge side effects. because it's a poor drug. It just doesn't work. Okay, so it's helpful to start on a medicine that lasts for the entire day, one of the psychiatrists says. But if someone's feeling a little bit nervous about medicines or doesn't want to fully commit to 9 hours or some side effects makes them feel uncomfortable, I might start them on a short-acting stimulant that lasts just 3 to 4 hours, which is the immediate release methylphenidate, the Ritalin. It's the brand name. Methylphenidate is actually, I use a PMS only because the non-medicinal ingredients of the other ones, like Novartis with its Ritalin brand, and other brands, it give me rashes, right, and allergies. So I can only take PMS brand, and that is what I'm gonna put some of my money as investment for. It's called Pharma Science PMS. All right. So if the stimulant doesn't work, what do? You look into non-stimulants like clonidine and guanfacine. I had my doctor try putting me on that. It was funny. He was like, "Is it working?" I'm like, "What do you think?" And then he was like, "Yeah, okay, we're gonna get rid of it now. You're going back to your methylphenidate." All right. This medication helps calm the body and appear to boost the function of prefrontal cortex, aiding focus and executive functions such as planning and time management. All right, so dealing with the side effects. The next step, tempering side effects such as appetite suppression, difficulty sleeping, irritability, especially seen with patients rebounds as medication wears off. So I would call that burnout. Some kids are more highly affected by appetite suppression. I will try to make changes so they're eating a bigger breakfast or dinner. But you know what? Methylphenidate, it is a stimulant, and stimulant is supposed to make you digest faster. But it also does suppress your appetite. But if you're eating a balanced diet, you don't have to eat 3 meals a day. Like I eat like 1.5 meals a day, and I'm vegetarian mainly. I put a little bit of meat in mine or chicken because I need the protein, and I get it from tofu and beans. So, I don't believe in this ADHD diet crap that some of the magazines are, talking about. But, anyways, medicine, yes or no? The controversy of medicine for ADHD has raged for decades. But those on the front line of ADHD say that for older children and adults, a risk-benefit equation is best, which means you gotta consider pros and cons of taking medication, as well as consider the side effects, because sometimes the side effects can go away if you figure out. And it is really by trial and error, and that's why it's the hardest part for ADHD and the medications. I tried almost everything with my doctor, and we went back to methylphenidate, which is what my McGill psychiatrist that I went to has prescribed me in the beginning, and because nothing else worked. So you really have to target it as a one-on-one patient basis, and definitely including CPT as well, not just the medication. All right, so think about this. If you reject meds as an adult, do you have the flexibility to switch job or environments to ones that will tap your talent while leaving ADHD challenges behind? For me, I cannot live without my methylphenidate. My innovation, not so much motivation. Motivation is internal. It should be internal. But it does give you a little bit of motivation. Like now, I had a really long day, really hard day, and, I just took my methylphenidate, and it gives me a little bit of positivity, I guess, take that negative emotion away. So essentially, dopamine overrides the serotonin part. All right. For many others, a little help focusing is what they need, and the medicine that makes it easier for them to master their executive function skills is just the ticket. Even then, these medications are not a cure. They're just helping tools. It's definitely not a perfect science. You still have to pick up the other portion of it by working through cognitive skills around organization and productivity, hence CBT. Good night, guys.